Welcome to the office.
How you doing?
Good.
Hi, Mom.
Hi.
We had one visit.
Only
One visit.
Yeah.
And Susie came. We wanted to evaluate her spine with scoliosis, right?
Yes.
And we found a few things going on in terms of her foundation. And we started on her foundation. Yeah?
Yeah.
And tell me, what's different?
Everything feels better.
I can't hear you.
Walking.
I can't hear you. What'd you say?
The walking is easier and everything feels lighter.
That's pretty cool.
Yeah, her walking is changed.
Good. Easier.
Easy.
How's the sleep?
Good.
Good. Not bad with the sacrum
She
adjustment.
half sleepopia. She making noises. It's because of syrinx also I read it.
The syrinx, yes.
Mm-hmm.
And we're going to talk more about the syrinx later. Right now we're focusing on the
Okay.
foundation.
Yes.
Do you have any questions for me?
No, we are waiting.
Yeah? You had a question for me?
Yeah.
What was your question? What was your
Can I
question?
swim after the treatment?
So her question is, can you swim after getting an adjustment?
Yeah.
Yes. 100%. Because we love swimming, we love full body movements, okay? Obviously, you're not gonna dive in and just start going crazy. You go inside, you get your body movements, you warm
Slowly,
up.
yeah.
Yeah,
Mhm.
okay. And
Not
from
jumping, remember Susan.
no jumping just yet,
Mhm.
okay? But horseback riding is good.
What?
Horseback riding is good.
No.
No horseback riding.
No, okay.
Walking, you're doing your walks.
We're walking every
Awesome.
night.
Okay. Shall we continue? You ready?
We are eager to know what's happening.
We're eager to know. All right, let's take a look and see what's going on. Let's run the meter on the back. So with Susie, we have her x-ray. And I'm going back to the foundation here. And what we have here is, just go down. All right, what we are going to do, let me just do a screenshot, cancel, record. Okay, so basically on Susie's foundation, this is where we're focusing on. We'll talk more about the syrinx. We'll talk more about the syrinx and everything else a little bit later. Right now our focus is, like I said, her foundation, and we talked about her having a few tailbone injuries, a few injuries during childhood. And what we found was a rotated right sacrum and a rotated pelvis on the left with a short leg on the right. What our goal is here is to work on the tailbone and bring that up and get this under 7 millimeters. With the MD of 7, if I adjust this pelvis first, it's going to make that hip difference more. So that's why we're not working on the pelvis. Does that make sense, Mom? Okay, so let's go ahead. Let's continue. Let's see what we find. Legs down, please. Was the adjustment a little spicy for you, Susie, or was it okay?
A little spicy.
It was a little spicy, right? Okay, scoot back for me, please. But you were okay with it? You were able to handle it? Mm-hmm. All right. So, and we have something to compare in terms of her walk on the first visit. Head down, please. And what you see is I have to follow the contour of the spine when we're scoping. You can't go straight down like this because there's curvature in the spine. So the idea is you need to follow the contour of the spine. And we're getting some pressure in the middle today around T12. For 5 points today. Okay. We had more last time. We'll look at the previous video. It was more than 10 points, I believe.
Mm-hmm.
Hi. Is that tender? Nope. Okay, so S1, S2, S3. That was the one that you were like, ow. Still a tiny bit, right?
Yeah, it's still a tiny bit there.
Tiny bit there. 5, 4, 3, 2, 1. Back slowly towards me. Tender in there. Not too bad. This one is probably compensating for this. So we're going to continue on her sacrum. After the sacrum, we'll recheck everything and see what we need to do. Okay? You guys sound good? You ready for me? Now, we're going to go on the high-low, okay? And the reason why is, if I can go on the side, but I would like to do the high-low to get a deeper set here. And after a couple of adjustments, then we'll probably go on the side so we can elongate and we can actually stretch the spine out more for the adjustment. Otherwise, she's in too much compression during the adjustment. Shall we? Let's do it.
Who is smiling the most?
What's that?
Who is smiling the most here? You.
I'm smiling because she did well. I'm happy when they do well. Dun, 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 dun.
The stretching is safe for syrinx.
Stretching? What kind of stretching?
No, she's stretching. No.
You got it? Right now is just light movements and walks. She wants to do some light hanging for stretching is okay, but no yoga or any of that right now.
She can hang on wall. I
She
bought
can
something
hang lightly.
lightly.
Okay.
Oh, we can do it lightly. Like
Well,
1
you just
minute.
hold. Yeah, no, you just hold.
Okay.
You just hold, and you can use a chair so
Yes.
she's not hanging her whole body weight.
Okay.
And just to get the
stay.
stretch,
Okay.
yes, just to get a good
I buy
stretch.
the chairs. Yeah, I'm doing same, but I stop it. As I know there is syrinx, I stop it.
Yeah, so I don't worry, right now, like I said, with the syrinx and the
Yes, I
spine,
understand.
we don't want to overstretch anything
Mix
right
them
now.
together, yeah.
And we want to be mindful also of when she's stretching, yeah?
Mhm.
It's just like she's holding it,
Yeah,
right?
straight. Just holding straight.
That's it. Can you hold her legs, please, Mom?
Yes.
Okay, we're on the sacrum. And 3. S3. Why is it going so easy? Wow, it already went. Now we get the rest. Good. Ow! Oh my goodness.
That just scared me.
That was a home run. Are you okay now?
Yeah. I'm scared. It didn't even hurt.
Didn't hurt, right? Tell them.
What?
Tell them it didn't hurt.
It did not
It
hurt.
didn't hurt a lot. If it hurts, she's gonna shout.
That's
I know
right.
her.
Yalla, walk it up. Yalla. Emshi, emshi. Emshi. Emshi,
Open,
emshi.
open.
Come, I open the gum. Emshi. Turn around. How do you say yalla move? You say yalla? You say move it? What do you say?
Gnatzing.
Na?
Gnatzing.
Ganatzing.
Uh-huh.
Ganatzing. Ganatzing.
Oh my god.
Ganatzing. Did I say it right?
Let's go. It's like let's go Gnatzing.
Ganatzing. It sounds like it's nothing.
Ah.
Now she's getting some movement in her hips. Good job.
She's flying.
Walk on her toes, tippy toes.
Toes.
Back over here, have a seat, please. Very nice. Awesome. Shasha!
Mm-hmm.
What's up?
I'm happy for her. She's
Are
doing
you happy
great.
for her?
I'm very happy for her.
I'm actually more happy for Mom.
Oh.
You know why? Because she's the one hunting and searching for an answer all this time.
Yeah, I'm doing it already 3 years.
Let's take a look and see. So even the, all clear. Hey, Mama?
Mm-hmm.
So this cleared that. All clear. Now, back slowly towards me, please. All, oi. Any pain?
No.
Nope. Let's go on your back and work on your ankle, please. Let's go over here. Firm. There you go. Both hands. Gotcha. Sit up and turn, please. And now, you get a little buff and polish. This is to soothe the tissues in the back of your sacrum, okay? Let me know if anything, it's gonna feel like a little tickle. All right? Little tickle?
I'm used to these type of stuff, so.
You're used to these types of things? Fun fact, did you know Dr. Gonstead was the first to illustrate pelvic misalignment? Illustrate it, show how it misaligns, created a marking system, and showed how to correct it. And before Dr. Gonstead, we're talking back in like the 40s, because he was practicing in 1923, it was illegal to touch the pelvis.
Why?
Because they said in the profession, the SI joints are immovable joints. There's no point in adjusting. It doesn't do anything. And Dr. Gonstead, after 200 cadavers, he had dissected 200 cadavers on his time off to really understand the anatomy of the human body. And with the pelvis, he came up with this marking system. So the marking system you guys see me talk about in terms of the misalignment, the correction, the measured difference, the actual difference, this was all created by Dr. Clarence Gonstead.
Thanks, Gonstead.
You know, thanks God. But it's interesting what's happened today. It went from specific analysis of the pelvis. It went from specific analysis of the pelvis to find which one is subluxated or which one is the problem. And the way he talked about it is this: it is very rare to have a double subluxated ilium, meaning both SI joints are stuck. One usually misaligns or gets stuck, the other one compensates. And so to adjust both sides on a routine basis is not actual in this work, okay? So adjusting one side and the other, you kind of negate the neurology. You may get the movement in the pelvis and the motion, but you're negating the neurology, which is the intention of Gonstead Chiropractic or chiropractic. So I like to share that.
Yes.
It's very, very important. So it went from...
We have to know and share it also. Lots of people needs to be cured, but they don't know how to do it.
Right.
Like me. I'm suffering already 2 years. It's second visit we are here. Hopefully, we'll see the result.
Hopefully. But we also know, Mom, it is a process, right?
Yes, I know.
So this is not that I have to adjust her 2-3 times a week for the rest of her life. That's not what this is. This is for her age. She's getting great sets. Her
Okay.
sacrum is setting very well.
Okay.
And she needs to move. That's it. And in a couple of weeks, okay, we're going to address the syrinx. You want to share about the syrinx? How
Of
big is
course.
the syrinx? Where is the syrinx?
syrinx, it's starting from C3, it's going to T10. First MRI, it says 0.8 millimeter.
Yeah.
The second shows already one centimeter.
Correct.
I don't think it's big difference because every time scanning showing different results. But still, I am very concerned because the neurosurgeon, it says we have to do operation for her. It's very, very dangerous.
Did they tell you why she has a syrinx? What is
She
the
has
cause?
KRE1 malformation, deformation. She has it. I don't know. It's born or it's coming from lower back.
We have a couple of cases like that, and most of them were born with it. Okay, but we don't know.
We can't say exactly.
We can't say because we have nothing to compare to. So the idea again is She's out of balance. She has these symptoms.
Yes.
Get her in balance.
On
And
your
I would,
shoulders.
yeah, I would suggest this. We should plan on a new MRI in about 6 weeks to 8 weeks.
Yes.
Okay.
When you finished.
Yeah. Okay.
Of course. Of
Madam?
course, we need to do MRI. Yeah.
Come over here. Have a seat. Sit back for me. Sit back. Let me work on the shoulders slowly.
Ow.
Ahí. Slowly, slowly. That's it. I want to just get movement there. Can I check your hands? Stand up. Squeeze. Come right over here. Stand over here. Stand over here. Stand over here. Squeeze. Let go of this hand. Squeeze. You're strong. A little bit on the elbow. Squeeze. Squeeze. You're all set for today. You have a fantastic weekend. Bye. Take
Thank
care.
you, doctor.
You're welcome. God bless you.